Hello, everyone. My name is Maryam Khan. I am a program associate for resource development at the Community Engagement Center, which is a joint venture of Pakistan's Indus Health Network and Interactive Research Development. In today's presentation, we will be looking at lessons in community engagement from Pakistan from a critical lens. The Community Engagement Center works towards the empowerment of local populations, especially in the context of health. It identifies and develops key access points in communities in order to create enabling and supportive environments for behavior change and ultimately link these marginalized communities to the health facilities and other services that they require. It aims to connect community needs with relevant public health solutions, empower communities to realize their own strengths, and develop specialized personnel with the capacity to build trust and mobilize communities. In this presentation, we will discuss how the utilization of critical and participatory community engagement can foster change and what community engagement has learned from community psychology and put into practice. Historically, community engagement in Pakistan has been weakened by certain pitfalls. For example, organizations take top-down expert approaches. They have pathological portrayals of low socioeconomic status communities, for example, that they are vulnerable or completely helpless. And there is often a focus on strictly biomedical outcomes, for example, when you work from a specific disease framework. This paints inaccurate portrayals of what happens on the field, and it also distorts expectations of appropriate outcomes for community engagement. To counter this, the Community Engagement Center utilizes SALT, which stands for Stimulate, Appreciate, Learn, and Transform. This is a community engagement methodology that focuses on relationship building. It helps communities identify their own strengths and enables them to develop existing systems that they already use to solve problems. SALT, in line with community psychology, utilizes critical participatory engagement to promote ownership, empower for sustainable change, and improve health outcomes. It provides a framework for working with those marginalized by the social system and those who are pathologized as helpless. As a critical approach, it allows us to depoliticize language and concepts and work with sociopolitical ideas such as liberation and social justice. This brings us to our next question. How can community engagement be critical? A core goal of critical psychology is to transform psychology into an emancipatory, radical, social justice seeking, and status quo resisting approach that understands psychological issues as taking place in specific cultural and historical contexts. To be critical, you must reflect. Is your analysis one that requires stepping outside the dominating framework of your society? Where is your argument taking you, and in whose interest is it? What is the action that is being taken? What's your action? And is what you're doing in the spirit of inquiry, respect, or solidarity? In practice, we can be critical by making our approach ecological, values driven, guided by the values of social justice, dependent on social action in partnership with disadvantaged people. From such a perspective, moving from a state of oppression to one of well-being is a multi-level ecological process. And to achieve this, careful consideration should be made of the ecological context of the problem at hand, consideration of how change occurs over time at each level of analysis and intervention, and how relationships with communities are that are experiencing injustices. Since we understand that critical psychology is all about resisting the status quo and emancipation, we should also understand the value of exercising power. By exercising power, one can transform oppressive institutions by eliminating oppression. They can alter the basic premises of unjust systems, and they can challenge the status quo's underlying legitimacy. For community psychology to achieve its main goals, Bryltansky outlines some main ingredients. Firstly, careful consideration of specific ecological contexts must be made for each problem and at each level that an intervention can be made, how change occurs over time, And lastly, but most importantly, building relationships with communities that are experiencing injustices. To be critical in community engagement, therefore, is to take an ecological approach in action, to be value driven, to be community centered, and to take part in social action in partnership with marginalized communities. Inevitably, we can understand community engagement to be like community psychology, but praxis oriented. To be praxis oriented while taking an ecological approach that is community centered means to consider and operate through three ecological spheres of experience. These spheres consider contextual and political factors on three levels. First is the individual, which includes the unequal distribution of health problems, exposure to risk factors, disempowerment, and internalized oppression. Next is the relational sphere, which includes social relationships, stigma, neglect, and social exclusion. And third is the collective sphere, which includes barriers to healthcare, low social capital, economic inequality, and a sense of community. We posit that SALT engages communities at these three levels and creates the momentum needed for social action to take place. We demonstrate this by presenting a case study from our work in the field from a place called Gurmani. Gurmani is an agricultural village located in the rural south of Punjab. 64% of the communities living there are engaged in sugarcane farming, which nowadays often has a very low yield. The area also has limited access to clean drinking water. And unfortunately, because of the lack of access to clean water, skin conditions and gastrointestinal illnesses are very common. Our case study is from the Duba Lashari community in Gurmani, which is mostly comprised of laborers working on one landowner's land. These people did not have access to clean drinking water, and our community health worker also observed that the water they had, when left sitting for long enough, would turn yellow and tasted very strange. Because of the quality of the water, gastrointestinal illnesses were very common in their community. Boiling the water was out of question because it was too time and fuel consuming, and other sources of water that they could have accessed were too far away for the community. Time and time again, the community had approached people with political links and even voted for people who claimed that they would solve this issue for them. However, to date, no action had been taken to get them access to clean drinking water. The community health worker in the area discussed with them what their own solutions could be. They said that boiling the water was too time and fuel consuming, and all the other sources of water were too far away for them to access, which meant that they had little to no options available. The health worker then suggested that they go to their local landowner to try and find a solution. The community was worried that if they approached the landowner and asked him to provide them with clean drinking water, he would get upset and he would prevent them from working on his land. The community health worker in the area used a few SALT activities to engage the community in a discussion on the fact that they were also a resource for him as his sole labor force. He reminded them that they had strength in numbers and that if they went together and shared their concerns and expressed that they would like a source of clean drinking water, he would not be able to refuse them. A group of male representatives from the community took heart and approached the landowner for a conversation. They told him that they would like clean drinking water in their community, and because there was none, so many of their children were getting sick. Instead of refusing them, as they were afraid he would, the landowner agreed and within a few days started setting up a tube well in their community. Through this, the community was able to overcome their internalized oppression and also realize that standing together, they had a sufficient amount of strength to take action and create change where they required. By using SALT, the community health worker was able to engage the community on the three spheres that we discussed earlier. At the first individual sphere, the health worker used some aspects of SALT. Mainly, He stimulated the community to recognize their own self worth and value as a resource, and taught them to appreciate themselves and recognize the power that they held. At the relational sphere, the community health worker was able to stimulate the community to recognize that their strength in numbers could create a change. And this exchange of knowledge created an enabling environment for the community to take a step forward. At the collective sphere, the community was able to learn and realize that they held a certain amount of power when they stood together, and they were able to transform this power into social action, which allowed them to eventually obtain access to clean drinking water, which would improve their health outcomes in the future. By working collaboratively and in partnership with communities, the community health worker was able to promote ownership, empower for sustainable change, and improve health outcomes. The community was able to problem solve, they were able to engage in a collective action, and they were able to strengthen their existing ties while recognizing that they had existing political power that they could exercise. They were also able to advance on a local solution for their problem. Ultimately, they were able to obtain access to clean drinking water, which meant that they would be able to improve their health outcomes in the future. The Community Engagement Center is able to put into practice the values of community psychology from a critical lens. Engagement is thus emancipatory and status quo resisting. The dynamics between the workers and the landowners in this case study could have been a classic example of the kind of oppressive class dynamics that exist. However, engaging with the community transformed this relationship into one that was facilitative and not oppressive. I would like to thank you for taking the time to watch this presentation. And we would also like to thank our field team for their dedicated efforts on the ground and the outreach department for their supervision and guidance. Additionally, our directors who provided the vision and support to execute our ethos. Without these key players, our work would not be possible. The Community Engagement Center is a joint venture of Indus Health Network and Interactive Research Development. If you would like to know more about us, you can contact us at the email address given on this slide. Thank you for your time, and I look forward to hearing from you.